Are you within the time frame?
Yeah. Yeah.
Okay.
當然要高啲，咁樣，咁得。
Okay.
Hi, my name is Chang. I'm one of the nurses here at CPHC. My pronouns are she, her. Nice to meet you. I see that in your chart your first name is Jessica. Is it okay for me to call you this, or do you have another name that you prefer?
You can call me Jessica.
And what pronouns do you use?
She, her.
Great, I will know this in your chart. So before we start, I want you to know about our confidentiality statement. Everything we discuss will be kept private between us and the healthcare team. Unless you tell me that someone is hurting you, you plan to hurt someone else, or you plan to hurt yourself, then we have to speak with someone else to get you the support and help you may need. Is that okay with you?
Yes, it is.
Okay. May I ask the reason for your visit today?
I would like to know more about different kinds of birth control
Okay.
methods. Yeah.
And do you plan to get pregnant in the next year?
No, because I plan to go to medical school and I don't want to be pregnant when I'm doing my residency.
Okay, great. Do you want to have kids in the future?
Yes, after my residency.
Great. So what I heard is that preventing pregnancy is very important to you while you're doing medical school and medical residency. Is that correct?
Yes.
Great. Now, what are you looking for in a birth control method?
Something that's effective and easy,
What else?
and long-term but reversible.
What else?
That's it.
Okay. So what you're looking for in a birth control method that is very effective, long-term but reversible, and easy to use. Is that correct?
Yes, it is.
Great. I'm going to show you a chart of different birth control methods. The chart groups different methods based on its effectiveness, with the tier 1 with the top row being the most effective one, and as you go down this chart the effectiveness go down as well. So based on your preference, the arm implant and the IUD, the intrauterine devices, are the one that best fit your needs. They're in the first row here because they're very effective, meaning that in 100 users, only 1 or less people will get pregnant in a year. The arm implant is a small rod that contains the hormone progestin in it. It will go right underneath the skin of your inner upper arm, and it usually lasts for 5 years. For IUDs, they are T-shaped plastic device that goes inside your uterus by a provider, and they can contain either copper wire wrapped around it, or they can have the hormone progestin in it. And they, depending on the kind that you choose, they can last anywhere from 3 to 12 years. All this method needs an in-person visit with a provider to start, but you can stop anytime for any reason. You just need to have the provider remove it for you. And once the arm implant or the IUD is removed, your fertility, meaning that your ability to get pregnant, return right away. So now tell me, when will your fertility return after the arm implant or the IUD is removed?
Immediately.
Correct. Now, I can also show you some other method. Even though this method are very effective in preventing pregnancy, they do not protect you from STIs. And the only method that protects you from STI or sexual transmitted infection is condoms, external or internal condoms. So can you tell me which birth control method protects you from STI?
Condoms.
Correct. Now, There are also some other birth control methods here in this chart. Is there any one that you want me to go over?
No, I'll just go with the most effective ones.
Great. And the one that we have covered so far, do you know which one you want to know more about?
The copper and hormonal IUDs.
Okay. So IUDs are not for everyone. There are certain conditions that will make IUD unsafe for you. So please let me know if you have any of the following conditions, like infection of the uterus, the tubes, unknown vaginal bleeding, pregnancy, cancer of the uterus, cervix, or the breast. Do any of these apply to you?
No.
Great. Now, before I dive into details about IUD, let's talk about emergency contraception. So emergency contraception is another way that you can prevent pregnancy, even after unprotected sex or your current birth control fails. There are two forms, like easy pills in a pill form or IUDs. So the easy pills work by preventing an egg from leaving the ovary. So when there's no egg, there's no pregnancy. The easy pills does not stop a pregnancy when it started. It does not harm you or the baby. It's not an abortion pill. It does not cause an abortion. So the Plan B is one of the easy pills that you can purchase over the counter. It's best to use within 3 days and up to 5 days after unprotected sex. It contains a hormone progestin in it. The Ella is another one, but you need a prescription from your provider. It does not have any hormone in it. And you might need to wait 5 days before starting an ongoing birth control, hormonal birth control method. The IUDs can also work as an emergency contraception, and they are nearly 100% effective if they are placed within 5 days of unprotected sex. Again, the emergency contraception need to be used ASAP and within 5 days after unprotected sex to prevent pregnancy. So can you tell me how soon should you use emergency contraception if you have unprotected sex or your current birth control fails?
As soon as possible and up to 5 days.
Correct. Now let's talk about IUD as a birth control method. What do you know about IUDs?
Where's the question?
我們 skip 咗呢？哦，呢份係舊嘅。
Oh.
呢份係舊嘅，所以佢係 in the back 嘅 ，in the back。但呢啲係新。
Oh, no. What do you know? Okay. So what do you like to know about IUDs, right?
唔係，呢度係 What do you know about？係 back in the back，in the back。呢度我未 highlight。
Oh, okay. Okay. I only know that it's placed in the uterus.
Great. So I will be covering what an IUD is, how it works, how well it works, how do you use an IUD, side effects, complication, warning sign, advantages, disadvantages, and yeah, that's it. There will be a lot of information, so I encourage you to stop me if any information is not clear to you. So what do we do if anything is not clear to you?
I'll stop you and ask you to clarify.
Great. Now, so an IUD is a T-shaped plastic that is placed by a provider into your uterus. So there are two types. The copper IUDs, like this one, that has the wire wrapped around it. The copper wire wrapped around it, and there's also like the hormonal types. The copper IUD, also known as the Paraga, can last up to 12 years. And the hormonal ones, they all have the progestin hormone in it. There are currently 4 different hormonal IUD in the market. So this is the Skylar. It can last up to 3 years. The Kalina, which is not here, can last up to 5 years. Marina and the Laletta can last up to 8 years. So can you tell me 2 types of IUDs?
The copper and the hormonal IUDs.
And what's in the hormonal IUD?
The hormone progestin.
Correct. Now, before we talk about how IUD works to prevent pregnancy, let's talk about how pregnancy happens. So every month you will have an egg leaving the ovary and staying in the fallopian tube for up to 12 to 24 hours. And if during this time a sperm is released via penile vaginal sex, and this sperm travel from the vagina to the cervix, uterus, and meet the egg at the fallopian tube, when they combine to form a fertilized egg, and this fertilized egg then travel back down to the uterus and attach itself to the lining of the uterus, and that's how pregnancy happens. So in short, you need an egg to fuse with the sperm, and this fertilized egg need to attach to the lining of the uterus in order to start a pregnancy. So IUD works in many different ways. It makes all IUDs makes the sperm unable to move. The copper in the hormonal copper IUD will limit the sperm function and reduce the sperm survival. So if you don't have any sperm, then you cannot get pregnant. And then for the hormonal IUD, they have similar effect on the sperm. The hormonal IUD has similar effect. The hormonal IUD's effect on sperm is similar to that of the copper IUD. In addition, it can also thin the lining of the uterus, so the fertilized egg cannot attach here to start a pregnancy. And they also thicken the mucus right here at the surface, so the sperm cannot travel up to meet the egg, so there will be no pregnancy. Now, can you tell me one way that IUD works to prevent pregnancy?
It immobilizes the sperm, and it reduces the sperm survival rate.
That's right.
Yeah.
Now, as we mentioned earlier, the IUD is very effective in preventing pregnancy. The copper IUD is 99.2% effective, and the hormonal IUD can range from 99.6 to 99.9 effective, meaning that in 100 users, 1 or less people will get pregnant in a year. So again, how in 100 users using IUD as the birth control, how many will get pregnant in a year?
1 to none.
That's correct. Now let's go into how we can use an IUD. So first, you will need an appointment with the provider to make sure you're suitable for IUD. They will examine you're suitable, like your cervix and your uterus is okay for IUD placement, and then they also check for STIs. Once everything is clear to get the IUD, then you can get the IUD. The provider can place the IUD inside you anytime you're not pregnant. They will use a special applicator and place the IUD inside the uterus through the vagina and cervix. And then during the placement, some people may feel a mild or sharp cramp, usually lasting like a few seconds. Some provider can use some local numbing agent to help with the pain during placement. And you can also take some over-the-counter painkiller like ibuprofen to help with the cramping after the IUD placement. So once the IUD is in place, the provider can cut the string IUD string, so they just hang right outside the cervix at the back of the vagina. And they will want you to check the IUD string every month. Just to make sure that the IUD is in place. If you're getting a regular period every month, then you can check your string maybe after your period. If you're not getting any period, then you can just choose any time in a month to check your string day. Can you tell me how often do you have to check the IUD string?
Once a month.
Okay, so to check the IUD string, you can put 1 or 2 fingers inside your vagina and try to reach the back of your vagina, just right outside the cervix. You should be able to feel like a soft, flexible string hanging outside of the cervix. Now, if the string feels the same to you, then your IUD is probably in place. But if you feel like the string is missing, longer, shorter, or you feel like a hot plastic bump at the cervix area, then your IUD might be out of place. And we also recommend that you check your string when you have abnormal cramping or abnormal bleeding or spotting. So if you have any of those symptoms, make sure to call the provider right away. Now, can you tell me one of the signs that the IUD is out of place?
If the string is missing or if it's, the length is different.
Right. And what should you do?
Call the provider as soon as possible.
Right. Because when the IUD is out of place, you could get pregnant. We recommend you don't have any vaginal sex until you're checked by the provider. But if you do, make sure to use a backup method like condoms, spermicide to prevent pregnancy. But if you did not use a backup method, when your IUD may be out of place, make sure to ask for emergency contraception. So how should you prevent pregnancy if your IUD may be out of place and you did not use the backup method when you have sex? So like if your IUD is out of place and you did not use a backup method when you have sex, you should ask for emergency contraception to prevent pregnancy.
Okay. I think you skipped a lot of questions.
有咩？
Set an alarm on phone.
呢個算啦，呢個唔理。
唔係㗎。
咪如果真係唔記得咗算。
Okay.
Once a month，我都講咗俾你聽，係咯 check。最緊要就 IUD 嘅個 removal day。removal day。跟住我講咩啊？跟住
place, but
仲有咩啊？
irregular. When do you need to call the provider?
呢個未到。
呢個 emergency contraceptive 喺邊啊
？Emergency contraception 係之前。
Oh yeah, it's different order.
之前。未到。呢度講咗，可能後尾加咗落去。
個 order 唔同咗。
後尾加咗落去可能。
Okay. Okay.
Yeah.
So emergency contraceptive.
Yeah. And IUD can be taken out anytime for any reason. But the IUD must be taken out if you want to get pregnant, if you want to switch to another birth control method, if you think you're pregnant, and when the IUD stops working. So to help you remember the IUD removal day, you can set a reminder in your calendar on phone, or you can write the removal day on a piece of paper and put it in your wallet. But please call your provider 2 to 3 weeks before the due date, so then to make sure to secure an appointment before the removal day. And if you still want to use an IUD as your birth control method, you can have the new one placed on the same day that the new one, the old one is removed. So can you tell me one reason you want to remove your IUD?
If I want to get pregnant,
Yeah. And
if there's irregular bleeding,
and how do you remind yourself that your IUD is due for removal?
I'll set a reminder on my phone.
Great. Now let's talk about some side effects from IUDs. Some side effects are common, but they are not life-threatening. So all IUDs can have pain during IUD input. Maybe they may also have cramps a few days after the IUD is placed, or when it is removed. All IUD can also cause spotting between periods, especially like right after it's placed. The periodal IUD may also have the following side effect, like longer, heavier, or crampier period. Hormonal IUD might cause irregular period, light or no period. They can also cause like headache, dizziness, abdominal pelvic pain, sore breasts, acne. But remember, most side effects can get better after 3 to 6 months. But if there's any side effect that bothers you, make sure to talk to our provider. What are some of the side effects that you may have with IUDs?
Abdominal pain, pelvic pain, yeah.
Okay, and what will you do about that?
Call the provider as soon as possible.
Maybe for those side effects, it's kind of common. To help with the pain, maybe you can try to buy some over-the-counter medication, and if that doesn't work, then you can call us.
Okay.
We'll try that first.
Over-the-counter medication.
Yeah. There are some complication and warning signs you need to be aware when using IUDs. Complication or serious health problem are extremely rare, but then they can be threatening. And this include infection or pelvic inflammatory disease, a tear or a hole in the cervix or uterus, but usually it's self-repair. The IUD could come out partially or completely, which means that you could get pregnant. In pregnancy, sometimes you can get pregnant even when you have the IUD in, and even more rare is the pregnancy, instead of being in the uterus, is in the tubes. And if you feel like you have pregnancy symptoms, do a home pregnancy test, and if it's positive, make sure to call the provider right away. Now I want you to be familiar with the warning signs to watch out for this complication. So please remember the acronym PAINS. P stands for late period, but that's only with the copper IUD. Abnormal bleeding, this could mean pregnancy or infection. Abdominal pain, pelvic pain, pain with intercourse. Again, can mean this could mean pregnancy or infection. I stands for infection or abdominal discharge. N stands for not feeling well, fever or chills. Fever or chills. S stands for like string missing or change. So it could mean that the IUD is out of place. Now, can you tell me the acronym for the IUD warning signs?
PAINS.
And can you tell me name one warning sign?
String is missing or changed.
That's correct. And what should you do?
Call the provider.
That's right. Now, so what do you like about IUDs?
I like that it's effective, easy to use, and reversible.
Some other advantages, it does not interrupt sex. The hormonal IUD may eventually make your period lighter, or you may have no period. The hormonal IUD can also protect you from the pelvic inflammatory disease, can protect you against the cancer of the lining of the uterus. And do you have any concern about using IUD?
Is that one of the questions?
Yeah. Do you have any concern about using IUD?
We've answered.
Cramping.
Oh, cramping?
Okay. So for cramping during IUD placement, and what do you think you can do for the cramping? What do you think you would do?
Take over-the-counter medication?
Yeah, for the cramping after placement, and if you want, you can ask the provider to see if they also offer local numbing agents to numb the cervix during the IUD placement too. So now let's wrap up. Can you tell me 2 types of IUD that we've covered?
Copper and hormonal.
And what's in the hormonal IUD?
The progestin hormone.
And can you name one way to that the IUD works to prevent pregnancy?
It slows down the sperm and reduces the sperm survival.
Great. Now, once in place, how often do you have to check the strain?
Once a month.
That's right. And what are one of the signs that the IUD might be out of place?
If the strain length changes or missing.
And what should you do?
I'll call the provider right away.
And what is the acronym for the warning sign?
Pains.
Can you name one warning sign?
Abdominal or pelvic pain.
Great. And what should you do with any of the warning signs?
Call the provider.
Right. Now, how do you remember to have the IUD removed when it stops working?
I will make a note on my phone.
And what birth control can protect you from STIs?
Emergency consult.
STIs.
Condoms.
Okay. And what can you use to prevent pregnancy after unprotected sex?
Emergency contraceptive.
And how soon should you use it?
As soon as possible, up to 5 days.
Correct. Now, do you have any more questions?
No.
Okay. So do you want to schedule an appointment? Are you ready to schedule an appointment with the provider?
Yeah, let's do it.
Okay, good. So I'm gonna walk you to the front desk to have the staff to have you set an appointment. I'm gonna give you some handouts to keep with you for reference. And please call us back if you have any further questions.
Okay. Thank you. I think that took longer. I'm gonna write down the answers because I don't want to flip the pages.
Yeah.
No, I think